Welcome back to The Bridge on WSAV. You know, when it comes to open enrollment, well, let's just be honest, it can be confusing and overwhelming. Well, here to shed some light on open enrollment and give you some things to think about is the sales director of UnitedHealthcare, and we're so happy to have her with us, Lee Turner-Cantrell. It's so good to see you, Lee.
Thank you. Thanks for having me.
So, you know, when it comes to open enrollment, I mean, even for myself, you know, it can be so confusing. For seniors and other people enrolled in Medicare, why is annual enrollment so important?
Well, for people on Medicare, making a choice for their health care is one of the most important decisions that they're going to make, not just for their well-being, but also their wallet. And since Medicare is not a one-size-fits-all, you really need to take the time to look at all the options that are available in your area and find the best plan that fits your specific needs and your budget for next year.
And you want to make sure that you are aware and you know exactly what you're choosing. And I can imagine that being so important.
Yes, exactly.
You know, Medicare annual enrollment can be overwhelming for seniors and for us at our age even. What advice can you offer to help make the process in choosing a plan just a little easier for people?
Well, Medicare can feel complicated, but we're here to help. And I'm going to simplify it. So 3 things you want to think about. First is, how did your plan work for you this past year, and is it changing for next year? You would have gotten a notification if you're on Medicare that your plan's changing by October 1st, and those plans go into effect January 1st. So you want to take a look, see what's changed. The other thing is, does it still fit into your budget? So don't just look at that monthly premium. You really want to look at the total cost of the plan. So that's things like deductibles, co-pays, co-insurance. You don't want any surprises when you go to use that plan, right? And then third, you want to make sure your medications are covered. So just because they were covered this year, plans can change. They might not be covered next year. And also keep in mind the costs of the medication can change for next year.
You know, the Medicare plan you select can have a major impact on your health and well-being. What are some things people should look for in a Medicare plan to help them stay healthy?
Right. So many people think of their Medicare plan as just giving them access to doctors and hospitals, but they really can help you live a healthier life. So the number one thing is you do want to make sure that the plan you choose gives you access to the doctors and hospitals you prefer. But beyond that, you want to look for plans that maybe have additional benefits like hearing, vision, dental. People are surprised that original Medicare doesn't cover those things. And so those are things that help us keep healthier, right? And then last but not least, take advantage of the wellness programs many of the Medicare Advantage plans have. Some of them even offer free gym memberships.
You know, the Medicare Advantage is one of the options people can consider. And I understand it has experienced rapid growth and enrollment over the past few years. But now I have to be honest, I have to ask you, what exactly is Medicare Advantage and what is driving the growth?
Right, so Medicare Advantage is Part C of Medicare. It combines your Part A, which is your hospitalization, Part B, which is your outpatient services like doctor's visits, all into one plan, and it's offered by private companies, private insurance companies like UnitedHealthcare. So it has had rapid growth. In fact, over the last 5 years, the enrollments in Medicare Advantage has increased by 40%.
Wow.
And I think the main reasons for that is the simplicity and the value people see in Medicare Advantage. One, it's a convenient plan. It's just one card you carry around, one company you have to deal with. And in many cases, it offers prescription drug coverage as well. So again, you're not having to fumble through your wallet and find a card for your doctor, a card for the hospital, a card for the pharmacy. Also with UnitedHealthcare, we have things like house calls. So once a year, a nurse practitioner will come out to the comfort of your own home, do a 45-minute to an hour visit with you. When's the last time you got to spend an hour with a nurse practitioner, right? They'll go through your medications, review your health, and they'll actually send that back to your doctor so then you can visit your doctor, go over any questions you might have. Another thing that UnitedHealthcare has that people find really valuable is we have programs and plans specifically designed for people with certain chronic conditions like diabetes, congestive heart failure, cardiovascular disease. And we can help people manage those diseases better help them live a fuller life. And then last but not least, the predictability of those plans. So on original Medicare, Medicare covers about 80% of the cost, and then you cover 20%. Well, that's not capped. So on Medicare Advantage plans, you have a maximum out-of-pocket. So no matter what happens, if something unexpected happens in your health care that year, you know that the most you're going to pay is capped out, and that gives you peace of mind.
You know, Lee, let me ask you this. What are some resources they should be aware of if they're looking for help or support as they make these decisions? Because sometimes it's not always easy to ask questions or even know what questions to ask because you don't want to sound like you don't know. And maybe they don't know who to ask. So what are some resources that can be used?
Well, there's a lot of resources out there. But if you want to learn more about United Healthcare plans, you can go to uhcmedicarehealthplans.com, or you can call the 1-800 number on your screen, and we can walk you through all the different options. Also, if you want to meet somebody, we have local agents in the area that will meet you at a time and place that's convenient for you, answer any questions. We also have meetings that we hold in the local area, and you can come out, ask questions, find out about the different plans that we have to offer. If you want to learn more just about Medicare, though, MedicareMadeClear.com is a great resource.
So, Lee, I want to say thank you for joining us today and providing us all the information that you did on open enrollment and Medicare.
Thank you.
It's great to see you. If you'd like more information on what we just discussed, Medicare, open enrollment, or you'd like to find out more about United Healthcare, all you have to do is go to the information you see right on your screen. You can also go to our website at any time, WSAV.com. Don't go away. We'll be back with more of The Bridge right after this. Stay with us.